Today's Good Health segment is brought to you by Sullivan County Community Hospital. When it comes to your vision, Sullivan County Community Hospital is clear. Cataract surgery and dropless cataract surgery are now available close to home. Cataract surgery is very common and impacts many older adults.
So we are born with a crystal clear lens. The lens of the eye sits behind the color part of the eye, and it focuses what we see. As time passes and as we get mature or older, the lens of the eye changes its transparency and becomes gradually cloudy. And in the early stages, the primary eye doctor, the optometrist, would identify that, change the glasses, and that would rectify the vision. But then it reaches a point where changing the glasses would no longer help. When that happens and the cataract reached that point, and that affects people's lifestyle and activity, and they feel that that impairment in vision is not satisfactory to them, that's when they seek treatment for cataracts.
Now patients can get this procedure at Sullivan County Community Hospital too. Dr. Satar finds for his patients having this surgery close to home is a great benefit.
It's much more convenient for them to have their procedure at home close to their family, and you don't have to travel the day of the procedure. So I think convenience for the older population is very important.
There's also the convenience of the latest in this procedure known as Dropless Cataract Surgery.
For years, the traditional way is to use eye drops, sometimes one bottle, sometimes two, sometimes three bottles of eye drops, depending on the ophthalmologist and what they are used to. These drops are antibiotics to prevent infection after surgery, steroids to promote healing, and non-steroidal anti-inflammatory eye drops to promote healing and also to help with pain. Recently, and not just me and only here, but across the United States, there is a method whereby you can put the medications in the eye at the time of surgery, and then you would not have to use any drops prior or after surgery. I would say up to 90 to 95% of the time. Of course, sometimes you have to add a drop, but that's a good percentage. And to me, that is extremely convenient for the patient.
It's convenient for the patient, and the doctor knows they are getting what they need for a successful outcome.
I'm very excited about that. You know, this morning we've done these 12 cases without any eye drops. So we put the medications in the eye, and the patient left the hospital without any instruction to use any eye drops. I am really thrilled. And the last thing is that you're putting the medication right where it belongs, as opposed to putting the eye drops in the eye, and then some of the patients would wipe their eye and don't get the benefit of the drop, or they don't put it in their eye because it's difficult for them. So this way, you know, the medication is where it belongs.
Sullivan County Community Hospital. Call if you have questions regarding this procedure at 812-268-4311. You can also visit online to learn more at SCCH.health.